Hi again, everyone. I'm Candace Kruger along with Jim Knox, and we're back again with another edition of the Best Docs Network featuring Forest Park Medical Center. Of course, Jim, Forest Park Medical Center, it's not just a gorgeous facility, but it's one of the top medical centers in all of the Dallas and Frisco area.
Exactly right, Candace. You know what? We're going to start off the show with an outstanding spine surgeon, one of the best in the Dallas-Fort Worth area. Of course, a Forest Park Medical Center doctor who helped one lady who was suffering from a great deal of neck pain. Here's Dr. Mark Valente.
For years, I suffered with neck pain, shoulder pain, and probably the last 5 to 6 years it started radiating down both arms.
A lot of times people don't realize that their underlying problem is coming from pinching of the spinal cord in their neck.
I couldn't even do housework. I mean, vacuuming, anything like that would cause pain. I couldn't play with my grandkids. I used to get out and play basketball with them and play softball, and I couldn't do any of that.
Rhonda had a lot of arm pain. She had numbness and tingling that radiated from her upper arms, through her forearms, and down into her hands, in both hands. She had worsening function over a period of a few months, and she was even developing some weakness. So we had x-rays and MRI done that showed 2 herniated discs. There's 7 bones in the neck, and in between her 5th and 6th bone and the 6th and 7th bone, the discs there were herniating and pinching her spinal cord and also the nerves.
He told me that he could do a very minimally invasive surgery whenever I was ready. It would be a small incision in the front.
Typically, neck surgeries are very successful surgeries. The outcomes are very good, and people recover a lot faster. We have to go through less muscle and tissue in the neck, even though we do these minimally invasive in the back and the neck. Still, patients' recoveries are much quicker and better in the neck.
I was amazed at how much better I felt. I mean, as soon as I woke up from surgery and was oriented, I was out of pain. I could feel my fingers, and it was just wonderful. I spent 2 nights in the hospital, and then my life started again. It's been wonderful, just wonderful.
Today, she's doing great. She's about 9 months from her surgery, and she's 99% improved is what she told me. So.
I wished I would have done it years ago. If I would have known the difference it would have made in my life, I would have done it years ago, because it made that big of a difference. It really did.
Did you know Forest Park Medical Centers utilize a paging system similar to those found in many restaurants today? The paging system notifies patients' family members as to their location and status while undergoing surgery at Forest Park. The system also allows the surgeon to contact the family members to update them on their loved one's surgery.
I had 2 surgical procedures at Forest Park. I had bariatric surgery in September, and I've had my back surgery in April of this year. The staff at Forest Park was cordial, respectful. The checking in process was done efficiently. There were no surprises. They had called me the evening before to remind me of what I needed to do to prepare myself. I sat in the waiting room a minimal amount of time before I was called back to begin the pre-op procedure. In both cases, I was in on one day and I was out the very next day and felt very comfortable during the process.
Just walking in, it did seem like a 5-star hotel, but we were greeted at the desk by the concierge. They gave my husband a pager and explained to him what the paging system was like. They would send him a text how I was doing in surgery, where I was at, everywhere in the hospital. He was able to see at any screen where I was. And so it gave him a great sense of comfort knowing that, you know, he was being, even though it was electronic communication, that still somebody was letting him know as I moved through the progression of the surgery area, the recovery area, back to my room, he knew. It was incredible how the staff made sure that my family was taken care of while I was being taken care of.
I felt like I was in a 6-star hotel. The service was great. The people were wonderful. I really felt that I was treated as if they really cared about me and wanted to help me and get me to start recovering quickly.
And I felt really good being there. I didn't feel like I was in a sterile environment. It just felt homey. And that was nice because, you know, when you're not feeling good, it's good to be in a place that feels like home. And it was a place that felt like home. And my husband was able to stay overnight with me.
The nurses, the staff, everyone seemed really happy and ready to help you out. Where I've been to hospitals where it just wasn't like that. The rooms at Forest Park were extremely clean. The exterior, when you first see Forest Park, it does look like a 5-star hotel. Everything about it was a good experience.
Best Docs Network featuring Forest Park Medical Center. Welcome to the 21st century of cutting-edge medicine. Forest Park Medical Center.
One of the things that is important in nursing or any type of career is making sure that everyone is well educated on what the expectation is of the facility. When I became the CNO here at Forest Park, I wanted to be able to focus on clinical education to make sure that we were always providing safe care to our patients and that all of our clinical staff were able to be educated on doing the same thing every single time to make sure that there was no room for any type of errors to occur. With that thought, we developed an educational program and hired a clinical educator that is master's degree prepared to be able to provide that type of education to our staff.
My role as clinical educator here at Forest Park is just to make sure all clinical staff are up to date on all evidence-based practices and current literature, and making sure that we provide our patients with top-notch care that is contingent on what research is backing these days. I teach anything from American Heart Association classes to ventilator classes to classes on hemodynamics to classes on basic needle sticks, blood draws, anything in the healthcare arena.
Clinical education is very important to both of my areas because, as everybody knows, healthcare is always changing. We are updating our processes. We are finding new and better ways to take care of patients. And I want to ensure that my staff is doing everything they can to provide the best care they can to our patients. And so here at Forest Park, we have our clinical educator, Dan Cloud, who is very active with the staff, finding out what areas they feel like they need education on and finding out what is the newest research and articles that are out so that we can make sure that we're staying abreast of all of the newest research and practices.
Just seeing some of the nursing staff or clinical staff, when you're teaching them something, when it finally clicks or they can take it back to the bedside with them in their interaction with the patients, that is the most rewarding for my job. I can talk and tell somebody how to do stuff all day long, but if it doesn't get taken back to the bedside, then it's not doing any good, especially in a healthcare setting.
All of our doctors here at the Best Docs Network, featuring Forest Park Medical Center, are dedicated to changing people's lives. Like our next best doctor, it's gynecologist Dr. John Dulemba.
Adhesions are the normal healing process of our body. If you get cut anywhere on your body, you develop scar tissue. You develop that same scar tissue on the inside of your abdomen, but what can happen then is that scar tissue then can cause organs to stick to each other. So the ovaries can be stuck to the pelvic sidewall or stuck to the uterus. The bowel can be stuck to the back of the uterus. So with all of this, this can contribute to some of the pain that women experience, especially with infections or endometriosis. And until you get the endometriosis out, those scar tissue is going to continue to grow. It's going to continue to interfere with their normal functions. 60% of bowel obstruction are from scar tissue and adhesions. So yes, this can be a bad problem. Usually start off slowly growing, and then they get thicker, they get their own blood supply, their own nerve system, and they hurt as time goes on as this disease progresses. So if endometriosis is the culprit that has initiated the growth of these adhesions, we have to go in and cut those adhesions because they cannot go away on their own. The less blood loss that you have, then the less tissue damage, any of that can help prevent adhesion recurrence. But it still can recur in over 80% of patients that have already had adhesions in the past. If left untreated, the pain may continue to get worse. So the key is you cut them out. The problem is you've now cut tissue, you have raw surfaces, more adhesions. So there are things that we do to try and prevent these adhesions from coming back. One is we use barriers. We put tissue down or different types of material to try and keep those raw surfaces apart. And unfortunately, other than maybe trying things like acupuncture or alternative methods, physical therapy, anything to try and help relieve the symptoms, there's really not many alternatives other than surgery and trying to prevent the regrowth.
Patty has a question for Dr. Richard Ha. Can I take fat from one area of my body and put it in my breast?
The answer is that the jury's still out. There's a lot of science that surrounds this, and what we do know is that it may not be completely safe. There is some data that suggests that injecting fat into the breast may increase the risk of cancer development. So for right now, until we have more information, it is not recommended that we inject or harvest fat from one area of the body to inject for the purposes of breast augmentation. So consult your plastic surgeon to have that discussion. It is probably still safer to undergo breast augmentation with conventional breast implants.
For more information on Forest Park Medical Center, Dallas and Frisco, your destination to better health, head to the website, bestdocsnetwork.com, and click on that Forest Park Medical Center tab.
And now we're going to check in with our next Forest Park Medical Center doctor. He's one of the top orthopedic surgeons. It's Dr. Garner Newton.
I had torn my ACL about in 2008, I believe, playing soccer. And it was something that I just kind of tried to rehab without having the surgery. I just was concerned about finding the right doctor to have it done. Honestly, I didn't have the time at the time to go through the rehab process. And what happened was I was in the backyard hanging a swing up for my daughter and jumped off the ladder because it started to move, and when I jumped, I hurt it again.
Well, most any sporting event that requires cutting puts you at risk of an ACL tear. Soccer, downhill skiing, football, basketball. It's a ligament that we can pretty much put back where it's supposed to be to try to allow you to return to that previous state of, or that previous level of activity.
I went to see Dr. Newton, and first visit, he said absolutely that my ACL was torn, and there was no reason at my age that I should leave it that way, that it wasn't a very difficult surgery.
It's an outpatient procedure this day and age, and the patient can walk even out of the hospital if they feel like it. Now, sometimes I will use crutches if they need them, but most of the time people don't need crutches even the day of surgery. I will use a CPM machine, which is a motion machine, to help them get their motion back, and an ice machine to help them with their pain. But the first 6 weeks usually is just letting them get their motion back. I do use a brace postoperatively. And then after that, after they've had some healing, then I start working more on strength and then endurance training, and then hopefully activity-related exercises to get them back to sport.
And the surgery went excellent, better than I could have imagined. I wish it's something I'd have done a lot earlier, because I played a lot of sports for many years wearing a knee brace, and I didn't really need to do that. I'm continuing to do a little bit of the physical therapy. Since we're towards the end of this now, I can't wait to be able to get back out and play sports. and just throw the ball with my kids in the backyard and not be concerned about my knee hurting, slipping again.
So typically when an adult presents with appendicitis, they may or may not have some nausea and vomiting. They can have a fever. In the early stages, they may not have a fever, but it's generally with abdominal pain, usually centralized around their belly button. And then over several hours, it will begin to migrate down to their right lower quadrant.
I was at the gym, remember on a Wednesday night, I went because I couldn't go that morning. Did my cardio, and I'm like, no weightlifting today. I just work my abs and go home, try to make it kind of short. And I worked my abs, I'm like, oh, wow. I guess I did too good of a job because they were like super sore. The next day came, and pain just came out of nowhere.
He went to his doctor, and when his doctor did a physical exam, he said, oh, I bet you have like an early appendicitis.
I ended up going to Forest Park Medical, and that's where I met Dr. Hodges.
Came to the ER, we got a CT scan of his abdomen, drew some labs on him, and he had a very early appendicitis.
They was like, yeah, your appendix is inflamed and swollen. You have to get it out of you ASAP.
You're able to do the appendectomy laparoscopically. Patient gets 3 small incisions, remove the appendix. It's generally an overnight stay, depending on what time that they present to the ER. At the time of surgery, if you do see that the patient has a large amount of pus in the abdomen, you can also opt at that time to also laparoscopically place a drain as well, and then remove their appendix at a later date.
Having my appendix taken out has a direct effect on me because I do play semi-pro football for the Greenville Bandits, and it's crazy because the season starts in 4 weeks, and I just had my appendix taken out, so I feel like, honest to God, true, I feel like I can go out there right now and play with the big boys, but you know, you got doctor's orders, and wow, you know, I just feel great. I'm really, really, really amazed with my results.
He's doing well. He was really nervous. He had never had surgery before, but he was a great patient. He did really well. He was able to go home the following day.
I'm joined now by one of the founders of Forest Park Medical Center and top bariatric surgeon, Dr. Wade Barker. Dr. Barker, thanks for being with us today.
Oh, thank you.
If you would start off by talking to us a little bit about what made you decide to practice medicine and specifically bariatrics.
Medicine is actually kind of a story that started in high school. I really didn't like school to start with. From first grade, I missed school, didn't want to go, and never thought I would go another 13 years after high school. But in high school, the valedictorian was going to be a doctor, and my pride was, well, if he can do that, I can certainly do that. And so it was really a pride thing that got me interested in medicine. And fortunately, I enjoyed the science, I enjoyed, biology and chemistry, and so it just was right down my alley.
And what's the most rewarding part of your job?
Seeing the results for patients and really getting a thank you, in a lot of fields and in medicine in general, that's your job, to take care of the patients and do the things correctly. And so people expect that. But in bariatric medicine, they are so grateful that they always remember to say thank you and tell you not just thank you, but how you've changed their lives.
And in a lot of times, saved their lives.
Realistically, that is true in the short term and in the long term in many cases.
You've obviously been an integral part of the development of Forest Park. How did you come to the vision of Forest Park Medical Centers?
Well, it really started in the OR. Dr. Toulson and I worked together every day. We worked long hours, and the hours were so long because towards the end of the day, all the hospitals would start sending the nurses home at 3 o'clock, and so we would go from 2 rooms down to 1 room, and it slowed things down. So we would do 8 cases in the first half of the day, and then only be able to do 2 cases or 3 cases in the second half of the day because it slowed down. It just didn't make sense. This is what they did for a living. This is how this was their business, and they were basically shutting us down. So we thought we could do it better. And so it really started as efficiency and being able to do what was best for the patient. You know, if you have a patient that comes in at 10 in the morning for a 1 o'clock surgery and that gets put off till 6, 7 at night because they've shut the OR down, that's not good for anybody. And so it really started from a practical manner.
What do you say to a patient to tell them how much better Forest Park is and why they should have their procedure done here?
I think we do it better. I think we do it more efficiently, and I think the patients have better comfort.
Thank you, Dr. Barker. We appreciate your time.
Thank you, Candace.
And stay tuned as we meet another Forest Park physician that is changing people's lives.
At Forest Park Medical Center, we do a significant number of weight loss surgeries. And I think it's a little bit disingenuous for us to provide surgical services that help people lose a lot of weight without having an organized way to help them get rid of what's left over after the weight loss.
The Post-Bariatric Surgery Center, the program started at Forest Park Medical Center because there is a need for this situation, this kind of surgery.
We felt that there were a lot of patients that had put a lot of effort in to undergo bariatric surgery and transform their lives, but they still were burdened by some of the problems that patients have after these surgeries before they undergo body contouring, such as excess skin, rashes, and other problems. We really feel like the full transformation is possible for these patients after they undergo body contouring.
Not only do you have problems with body image when you're very, very heavy, you can have problems with body image after you've lost all the weight and now your body doesn't look anything like you thought it was going to look because you've got stretched out skin that doesn't bounce back. You still have some thick areas that you can't lose, and it all is in places that you don't want. Because some patients ultimately, their diabetes gets better, their hypertension gets better, their overall health gets better, but their body image just shifts to another unhappiness. And that's what we're there to do, to try and provide that happiness for them.
The benefit of having two surgeons, and not just assistants, but trained surgeons, is that we work with one leading surgeon. The most experienced surgeon leads the surgery, and the second surgeon just follows through.
What that does is that it allows us to accomplish the same procedure in a staged fashion, but also in a more timely fashion.
There's no surgeon that can be as sharp at the end of that long, tiring operation, because this is physically demanding work. And so we know that if we extend it too long, patients aren't going to get the best result. So we get well-trained, properly trained surgeons working together to limit the operating time and improve the effectiveness and ultimately the results for our patients. At Forest Park Medical Center, we have the dietary issues, the nutrition part, we have the surgical weight loss, we have the post-bariatric weight loss body contouring component to get them to their final endpoint. So the continuum of care from beginning to end is all in one place. And Forest Park Medical Center in Dallas has the ability to do that, unlike any place else in the country.
For more information about Forest Park Medical Center, Dallas and Frisco, your destination to better health, head to the website, bestdocsnetwork.com, and click on that Forest Park Medical Center tab. Now it's time to head to our next best doctor operating right here out of Forest Park Medical Center. That is ear, nose, and throat doctor, Dr. Colin Pero.
Before I came to see Dr. Pero, I was suffering with chronic sinus infections and congestion and facial pressure, pain. So my family doctor had referred me to him to correct these issues.
When a patient comes in and complains of not being able to breathe, you have to address it in two different manners. The first is, do they have a functional problem? Is there something that is going wrong with how the nose is supposed to function? And the second one being, is there an architectural problem? Is there physically something in the way that needs to be corrected in order to improve the problem?
After Dr. Pero examined me, he ordered some imaging studies, and this showed that I had a deviated septum.
So when Ann first came in to see me, we talked primarily about the function of her nose. She had a pretty severe deviated septum to one side that was clearly blocking not only her airflow, but was also contributing to some recurring sinus problems that she had. And so ultimately we discussed correcting the deviated septum to correct not only the airflow through her nose, but also to help her with her sinus problems. At the same time, she had concerns about the external appearance of her nose, and so we addressed performing those at the same time, which for a number of reasons is not only easier, but technically beneficial to do at the same time.
Along with the surgical procedure for the repair of my deviated septum, I inquired if Dr. Pero could repair a small bump that I had on my nose. All of my family has it on my mom's side. I've always been extremely bothered by this bump, and he said sure, it would be a very simple thing to do, and I'm very pleased with the results.
So ultimately we did that. We addressed not only the outside shape of her nose while also addressing the inside of her nose. We were only not only to improve her nasal airflow, but also correct her chronic sinus problems as well.
I'm forever grateful to Dr. Pero for fixing those issues and getting rid of the bump, helping with my self-esteem and loving my look a lot more.
Recovery is well tolerated. Typically we tell patients to expect to be out of work for 3 or 4 days. That could be up to a week in some patients' cases, but it just depends on the patient.
Dr. Pero and his staff, they're very helpful, and this made me feel very comfortable and confident going into the surgery.
I was having severe pain in my knees. I had difficulty going up and down stairs and steps, even the curb. It hurt so bad to walk, even short distances. So I decided there was something wrong and something needed to be done. And I went to the doctor and x-rays were done. And the x-rays showed that I had severe arthritis in both knees.
When patients come in with arthritis, we often try non-operative means of treatment before we talk about surgery. Once patients exhaust all non-operative options for knee arthritis, we're often sitting down with patients and talking to them about the benefits and risk of a total knee replacement.
Both knees needed replaced. Came to McKinney, visited with Dr. Toulson. They did x-rays and determined, yes, it was time for knee replacement.
A total knee replacement is when we remove all the cartilage and lining of a knee joint and replace it with metal and plastic. The total knee replacement often functions just like a normal knee does. Patients often have no pain, and most times patients forget that they actually have a knee replacement in.
The surgery went wonderful. I haven't had any problems. Every day it gets better and better. I can walk up and down the steps now, getting into my home. Curbs are getting easier to get up and down.
After knee replacement surgery, patients can really go back to their same activities that they had before their surgery. Both hip and knee replacement are one of the most successful surgeries ever invented. After a year, 96 to 98% of patients are either satisfied or very satisfied with their joint replacement.
Dr. Charles Toulson and his staff took care of everything. From the time I walked into their office until the time I got out of rehab and was scheduled to go home. And today, I'm so glad that I had it done. It is better and better every day.
That'll do it. That'll wrap up another edition of the Best Docs Network, featuring beautiful Forest Park Medical Center, of course, one of the top medical centers in all of the Dallas and Frisco area.
Yes, Forest Park Medical Center, your destination to better health. And of course, from staff to surgeons to technology and techniques, Forest Park Medical Center has brought together the best of the best. For more information about Forest Park Medical Center, head to the website bestdocsnetwork.com and click on that Forest Park Medical Center tab. And in closing, we got to say this. Happy birthday to our great producer, Diane Faison-Rowe. I think she's 25 today.
25, maybe 27.
Oh, okay, maybe 27. Well, happy birthday, Diane, and we will see you next week. So long, everyone.